Good morning, students. Can we start? I think some of them have not got up. Can you hear me?
Yes,
Yes,
miss.
miss.
So you want to wait or we can start?
That means
10 more students to join. Okay. Okay, so first we will see how to do this technique. Then we will go into the other aspects. So as we all know, this massage has been divided into 6 classification. It has many classification, but we are taking the 6 classification because the 6 classification have lot of scientific evidence in proving in proving their effects and uses. So we take the 6 classification. Okay. So let me explain over a pillow so that then it will be easy for you to understand. Okay. So first is touch. So touch is so you just think that this is. Are you able to view this? It's okay, right? Like this. So you just imagine this is the back, but massage is not that we are going to give only in back. We will be giving all over the body. Okay. So just for easy explanation, I'm just telling you that it is on the back. Okay. So first is touches just touches to make accustomed to your hand or make accustomed the person to your hand feel. So you can just like normally what you will do is you will apply the powder on the hand. So we will use either we will use any of the lubricant. You will know at little later. So we will use normally we will use any of the lubricant and then only we will start with the massage. So if you want to use a powder, you have to keep your hand in the sides below the patient. Apply the powder in your hand. Then then you have to close it and do like this. Okay, you should not dust the hand. Okay, so close it and do like this so that it is spread in both of your hands. Is that clear? Then you have to start with touch. So touch is just touching like this. So when you are touching all over the body part, you will at the same time you will be spreading the lubricant all over the body part. Is that clear? So this is touch. So touch is you just cup your hand and you make sure that this part is completely touching the body part. So in touch we have superficial and deep. That is only the pressure difference. So superficial is just give a mild pressure, deep is give a stronger pressure like this. Okay, then when you are touching, you have to follow a sequence. Either you start from proximal to distal, so you just do like this, completely touch the body part with a good correct sequence. Okay, so don't overlap too much. At the same time, don't leave any body part. Don't leave any space. Okay, so you have to touch in a proper sequence like this. So completely the whole area have to be touched. So this is about touch. So you have superficial and deep. So next is like effleurage. In effleurage, you have something called stroking. then effleurage. So stroking is normally done from from the proximal to the distal. So again, stroking is also done to spread the lubricant and to relax the person's body. Okay, so stroking is using your fingertips. So stroking is using your fingertips. So using your fingertips. Okay, and another thing in massages, once you have started the massage, you should never remove your hand like this. So you have to do it continuously. So even though the stroking is from superficial, that is from the proximal to distal, so while bringing it down, you have to give a normal pressure. While taking it, it is just a touch. Don't give any pressure. Okay. So this is your stroking. So from the proximal, you have to give pressure and bring it down. Then you just take it with a mild touch. Then again, bring it down. Then again, a mild touch. Then again, bring it down. Okay, then again, a mild touch. So like this, you are supposed to touch the whole area with the stroking. Okay, so with the whole area have to be covered. Maybe you can do 2 or 3 times over a particular area, then go to the next. So sequentially you have to just change to the next area. Don't abruptly change the area. Is that clear? So this is your stroking. The next is effleurage. So effleurage is normally done from distal to proximal, and it is done to uh, remove the excess fluid. So you have to start from distal and you have to go towards proximal, and whenever you are going, you have to go towards the lymphatic drainage. So as I said earlier, we have a lymphatic node in the neck area, in the armpit area, in the inguinal region. Okay, and you have 6 lymphatic areas. Okay, lymphatic drainage. You would have learned this in your physiology. Okay, so go and recollect or go and check the slides. You have 6 lymphatic nodes to drain the fluid. Okay, so from the distal, you have to go towards the lymphatic node. So you effleurage have to be done with the complete area. Okay, so from the whole area will be doing the effleurage. Okay. So only thing is you can keep the thumb little bit like this so that when you are ending, you can drain it properly. Okay, so when you are ending, you have to drain it properly. So you start from distal, go towards proximal, towards the lymphatic. Then when you are ending, you have to do like this. When you are ending, you have to completely drain like this. Is that clear? So from proximal, you have to bring it towards the lymph node, then drain. Okay, so while bringing it back, you should not apply any pressure. While going it down only, you have to give the pressure. So from distal to proximal, you have to apply pressure. Coming back is just for the sake of touching the patient. Okay, so over the bony area, you can reduce the pressure. Over other areas, you can just apply the complete one. Okay, complete pressure or full pressure can be given. So over the bony area means like the scapula, you have to reduce little bit pressure, because otherwise you will be compressing the bone and it will be painful for the patient. Okay, so over that area alone, you can reduce. Remaining areas you can apply the same pressure. And in massage, the main thing you have to follow is you have to completely have the pressure throughout the session, and the pressure have to be equal. It should not be like little more, little less, or like it should not be irregular. It should be rhythmic and it should be regular. So that is very, very important. So sometimes if you are applying too much pressure and sometimes if you are applying too little pressure, then definitely it will be affecting the, it will not give you a full comfortable relaxation, or if you not, it will not give you a complete effects of the massage. Okay, so these are the things very essential. Then another thing is the direction. So the direction should be always towards the heart, so that you are pushing out the blood and you are bringing out the new circulation. It should not be the other way. Okay, so you have to keep this. These are some of the points you have to keep in mind. So then this is effleurage. Then if you are doing it on hand, then you can use either single hand, or if the patient is very bulky, then you can use single hand. If the patient is thin, then you can use one hand. Okay, so you can just see like this. It should not be from down. It has to be from distal to proximal. So you can apply like this. Then you can drain it in the elbow. Okay, so you can divide the body part and you can drain it in the elbow. So all the fingers have to be closed. Okay, then only the thumb will be coming out at the end of the movement. Remaining all, everything will be closed. Is that clear? So this is like using single hand. You can also use double hand and you can do it at the same time. Okay, so you can also use double hand and do the movement. So this is for your hands. Then next is kneading. So kneading is having a lot of sub classification. Any doubt so far?
No, miss.
So next we will go percussion. So percussion is to hit. So as I said, this is the hardest one in massage. So percussion has 4 types. Percussion has 4 types. One is beating. So beating is you have to make it a loose fist. So can you see it is a loose fist, but when you touch, you can see it will be having a complete one. Okay, so you just make it a loose fist. Okay, make it a loose fist. Then when you are touching the body part, this complete area will be coming into contact. Is that clear? So this complete area will be coming into contact. And what you have to do is you have to do good flexion and extension like this. So make it a loose fist. So when it is touching the body, it has to have a, it should not poke the patient. Okay, so it should not be poking the patient. The body has the body has to have a complete circular one. So you can just make a fist and see. So the body has to have a complete circular one. Then it has to be done in a rhythmic manner, flexion and extension. So don't do like this. Okay, so the movement has to come only from the wrist. It should not come from your elbow. Okay, so the movement has to come only from the wrist. So this is beating. So continuous alternate movement of both the hands. So initially when you're doing it might be little difficult and you will be able to do only one hand, but when you keep on practicing on a pillow, you will get the movement. Okay, so do it on both the hands simultaneously and alternatively like this. So this is your beating. Okay, so this is your beating, continuous flexion and extension of movement with the loose fist. The next is hacking. So hacking is the lateral aspect of your little finger, middle finger and little finger, index finger and the middle finger will be touching the body part. Okay, so this area will be touching. So you can see here, if you're able to see, you can see this area have to touch the body part. Okay, so little finger, index finger and the middle finger. So this 3 area have to touch the body part and you have to do radial deviation and ulnar deviation. So it is not like this. Okay, it should be like this. So it is not your flexion and extension of elbow. It is radial deviation and ulnar deviation of the hand. So when I am doing it very slowly, you can see the movement. Can you see? So radial deviation and ulnar deviation. And it should be alternative, and it should be continuous. Can you see it? So when you're doing it fast, it will be like this. Okay, so when you are doing it slowly, it will be like this. So alternate ulnar deviation and radial deviation of the wrist. No movement in the elbow. Only the movement will be in the wrist. Is it clear? So this is your hacking. Then tapping is the very lightest form. You will be using the fingertips. Can you see it? So only using the fingertips, you have to tap alternatively. So you can tap using all four fingers, just alternatively. So this is the very lightest form. Usually this is done for the face or for the children or any other person. So for adult, if you are doing it, it will not be that much effective. So wherever you need the very lightest form of the pressure, then you can use it, because you will not be able to give more pressure in tapping. Okay, you cannot tap like this. You will be doing alternate of all the fingers, and you will be doing it very lightly, very mild pressure only you will be able to apply. So this is your tapping. Then the last one in percussion is cupping. So cupping, as I said, you have to cup using the whole hand. You have to make it like a cup shape. Okay. Then this is normally done over the lung area, and it will help you to drain the secretions. So normally this is done for chest physiotherapy. Okay. So this is done to drain the secretion. Okay. So again, here also you have to do alternate flexion and extension. No movement in the elbow or no movement in the shoulder. Okay, so you have to just do alternative flexion and extension with your cup hand. So when you are touching the body part, only the outer ring will be touching, not like this. Don't beat like this. Is that clear? The palm should not touch the body part. Only the outer round ring should be touching the body part. So when you're doing it, will be seems to be like you are giving alternative movement with a cup. So that's why it is called as cupping. Okay, so like this. So you may not be able to get this continuous and simultaneous movement immediately, but keep practicing. Definitely you will get it. Is it clear? Can you see it? So these are the four percussion. Next is like kneading, petrissage. So this is a technique to break the adhesion. So normally you will be lifting the tissue, then squeezing the tissue. So when you lift and squeeze the tissue, you are going to break the adhesion in the break the adhesion. Okay, so that is very important. So here in kneading also you have four types. I think five types. One first is picking up. So picking up is normally like picking up, squeezing and leave it down. Okay, so normally this is done over the muscular area. So you can start from insertion of a muscle to origin of a muscle. Okay, so you have to hold it, lift, squeeze and leave it. Okay, I will show you in my hand. So you can see, can you see this? Okay, so it is not like pinching. Don't do like this. It is not like pinching. You have to lift using the web space. Can you see? So you have to lift and do it using your web space. So from either from insertion to origin, you are supposed to do it. Can you see? You are supposed to hold in between the web space, squeeze and leave it down. Okay, squeeze and leave it down. So this is your picking up. Then compression. So compression is nothing but with your cupped hand, you will be giving some pressure and give compression. Okay, like this. Okay, so normally it is done for the face. So you will give compression over the eyes like this. Is that clear? So compression is nothing but with a cupped hand, you are going to give apply some pressure. So this is your compression. Next is circular kneading. So circular kneading is using your hand. That is like your either depends on the area. If the area is bigger enough, then you can use your complete hand. If the area is smaller, then you can use the fingers alone. Okay, so you have to just circulate like this. Okay, so if you are starting from one area, you have to overlap 1 or 2 times, then you have to keep changing the position. So but you have to see to that you are not leaving any space untouched. Okay, so this is your circular kneading. If the area is very small, then you can also use your thumb to do the circular kneading. Okay. If the area is very small, then you can use the thumb to do the kneading. Next type of kneading is bringing. So here you have to use both the hands. So you have to use both the hands. Okay, so you have to use both the hands. Then can you see like pinching? You will be using both the hands, and you will be using 2 fingers. So hold the tissue with your 2 finger. Okay, then do back and forth. When you are doing back and forth, automatically you have to go to the next area. Okay, so don't do like this. It is not like this. You have to use your fingers alone. Okay, you have to use your fingers alone. So hold the tissue, do back and forth. When you are leaving, you have to just move to the next area. When you are leaving the tissue, you have to move to the next area. Is that clear? So this is your bringing. The next is skin rolling. So normally skin rolling is done over the loose tissue. So you hold it, bring the tissue, then squeeze the tissue. Okay, so hold the tissue, then squeeze the tissue and push it down. Hold the tissue, squeeze the tissue and push it down. Is that clear? So this is your skin rolling. So hold the tissue, squeeze the tissue and push it down. Hold, squeeze and push it down. So this is your skin rolling. Is that clear? So these are the 5 types of kneading. The next is your friction. So in friction you have 2 types. One is circular, another one is transverse. So friction is normally done using the thumb. So this is normally done over the bony areas. Okay, so normally it is done over the bony areas. So you hold the area, then give a circular movement. So for example, if you are using it over the breast, okay, so you can see here. So over the bony area, you have to give the friction like this around the bone. So this is your circular friction. Transverse is either parallel to the fibers or perpendicular to the fibers you have to give. So either parallel or perpendicular to the fibers you are supposed to do it. Okay. So this is your friction. So friction is to break the adhesion, especially over the joint, near the joint. So you can give over the joint with lot of pressure. Next is vibration. So vibration is nothing but you can use your hands or you can use any equipment. So you can reinforce your hand if you want to. Okay, so reinforce your hand and give the pressure, give the vibration from your shoulder. So for example, the pressure have to come from the shoulder. So the shoulder has to be straight and the pressure has to come from the shoulder. Okay, so you can see my hands. Can you see? It's just like a mobile phone vibrating. Okay, so you can reinforce your hand if you want and you can do the vibration. Is that clear? So like this. So this is your vibration. Shaking is you can hold the body part in both the hands, then shake like this. So this is again normally done over the chest. So you can hold the chest in both the hands. Then during the patient expiration, you have to shake and bring it forward. Okay, so this is your shaking. So normally this too has to be done from the shoulder. So the pressure has to come from the shoulder for this two things. Okay, so other things and all, if you see, the pressure will not come from the shoulder, but here the pressure has to come from the shoulder. So this is very important. Okay, so these are the techniques. So I will let me show you some videos so that you have a little more better understanding. Then we will go into the other topics.
Here we have effleurage, a continuous gliding motion. Here we have effleurage, a continuous gliding motion applied to the body with the palmar surface of the hand in constant contact with.
Okay, so this is the main thing. If you see, the therapist position should be walk standing position. So can you see the therapist position? So in this position, we will be able to touch the body, all the body parts, and it will be easy for us to walk around and do the movement without taking out the hand contact. Okay, so that's why the therapist position is very important. If you see here, the movement will be coming from the shoulder. There is no movement in the elbow or wrist.
The tissue. Pressure is applied evenly on the upstroke with light pressure on the return stroke. The general motion for this entire technique is movement towards the heart. Effleurage can be used as an introductory technique for touch, for spreading oil or lotion. The therapist needs to make sure that their hands are relaxed and flexible through the entire movement. You can also use effleurage as a way to introduce contact to a new part of the body or finishing strokes in different regions of the body. Another nice way to use effleurage is to take it as a transition between strokes. So if you were switching from tapotement to pin and stretch or any other technique, effleurage could be used. Common errors that we want to discuss. The first one here is we can see excellent biomechanics from our super therapist, but some things that can happen is sometimes people will lean too far back with their body and stand too far and wind up reaching to try and get up into the upper part of the body. And you can see that this puts a lot of stress onto the low back. It would mean a lot of low back pain potentially at the end of the day. Another common error is, if we get Jeff to step a little bit closer, is people looking right at the tissue, getting too low. A general rule, you want to keep your chest up while you're working so you have good biomechanics and a nice safe back. Now we'll show another variation from a cephalad direction. So from the upper direction here, this will still be a stroke towards the heart. It's a light stroke down and then a heavier stroke as he pulls tissue, pulls fluid back up towards the heart. So light stroke, heavy stroke. Light stroke down, heavy stroke back. And again, look at his biomechanics, nice and solid positioning, nice straight back, good work.
In this only the position, the technique is same, only the therapist position is changed. Okay, so next one.
Frictions. Frictions are small longitudinal, transverse, or circular movements that involve specific segments of tissue being moved against the underlying structures. No gliding takes place over the skin. The pressure is applied directly.
Okay, so this is transverse friction.
Directly towards the underlying structure at a typical rate of 2 to 3 cycles per second. Indications include joint restrictions, tissue adhesion, tendinitis, and ligament sprains. Basic application. Area being treated should be properly supported to reduce muscle guarding. Only use minimal amount of lubrication to avoid skin burning or hair pulling, otherwise lubrication is not required. The pad of the index finger or middle finger or thumb must be singled or reinforced, or placed directly over the tissue being treated. Hands or fingers not involved with friction may be used to support working the area around. You may also want to consider using instrument-assisted soft tissue techniques at the same time to save your thumbs and fingertips and take the weight off the smaller joints of your body. Frictions may be applied in a circular direction. Frictions may be applied in a longitudinal direction. Or frictions may be applied in a transverse direction. Friction direction is dependent upon the presenting condition of the patient and the treatment goals. Pressure is applied according to the general principle of superficial to deep. Make sure you begin with light pressure and progressively increase to the point of tolerance or tissue resistance. The amplitude of movement is minimal. While the rate may vary from modest to fast, pressure should never be released suddenly. At the beginning of the technique, the patient may experience mild discomfort. Make sure to use your 0 to 5 pain scale with the patient to make sure you do not exceed their tolerance. This is acceptable, providing the discomfort doesn't increase. If pain does increase, do not apply deeper pressure and discontinue the treatment.
Okay, so this is friction.
We're going to start off showing some variations of Petrissage kneading. So common variations include palmar contacts, which we see demonstrated here. You want to make sure to choose the right kneading type for the body tissue that you're working on, so we'll talk more about that as we progress through this video. The other thing to remember is the 4 S's of kneading. Strokes should be small, slow, specific, and circular. Phonetic S on circular, but there's your 4 S's. So we have a single palmar contact. We can go to a single reinforced contact for kneading. Note the good biomechanics from our super therapist Jeff here working through. We can also switch over to a double alternating contact if you wanted to. So small circular movements, spinning out from side to side. Again, excellent body position, good biomechanics. Techniques that can also be used will be thumb contacts. So double simultaneous thumb contact. Double alternating thumb contact. And a single reinforced contact. Keep in mind that this single reinforced contact, you want to be very selective where you use this. This puts a lot of pressure on the thumb over one area and may not be indicated for regions like the erector spinae. Fingertips may also be used. Fingertip contacts can include single contact and a single reinforced contact. And it is the opinion of this author that whenever you use a fingertip contact, whenever it's possible, try and reinforce that to split the pressure between two hands rather than taking it all the way through one hand. The next variation can include knuckle contacts. And we can have a single knuckle contact moving through. Again, our 4 S's are being followed as we cycle through. Slow, small, specific, and circular. Then we can have a double alternating contact with the knuckle. And the last variation will be a reinforced knuckle contact. Finally, our next variation will be an open C variation for kneading. And for the open C, notice how the body position changes, so we see good mechanics. He's square to the table, moving back and forth. Spine is in a nice neutral position, shoulders are down, and working well through the tissue. Pressure and release alternates from one hand to the other in a wave-like motion. When applied to the extremities, pressure is slightly more on the upstroke following venous return. Hand position and specific shape will change according to the size and shape of the body region being treated and the size of the therapist's hands. Skin rolling. Treatment starts with pre-assessment of mobility of the soft tissue. You're looking for the direction of maximum adhesion. Once this is found, cutaneous
Are you able to see?
and subcutaneous tissues are grasped, then lifted away from the underlying tissues. Then roll between the fingers and thumb with pressure towards the underlying structures. Use little or no oil. Establish a comfort and pain scale with the patient. Grasp and lift the skin between the thumb and fingers of both hands, making sure to maintain a closed hand formation, no L shape to the thumbs. Use the fingers to mobilize the skin tissue towards the thumbs. A sustained glide force applied through the thumbs while maintaining constant pressure on the underlying tissue. Fingers walk, the thumbs move as a snow plow, and you may apply this in any direction that you feel maximum adhesion. Skin rolling works well adjacent to spinous processes with the thumbs exerting pressure into the paraspinal muscles. Avoid pressure directly over bony prominences. Intersperse and finish skin rolling with general soothing techniques. And make sure to monitor the patient closely for reactions, as skin rolling can cause discomfort from some individuals. Following treatment, you want to finish up with a post-assessment of mobility.
So this is called pounding. Okay, so normally beating we will be doing with hands in supination, but when you do the same thing in mid-prone position of hand, it is called as pounding. This is compression. hacking. I'll show you again. So this is the exact skin rolling which I taught you. Okay, so you can follow this one. I'll show you once again.
Hello, I'm Rob Laubach, core instructor at the Soma Institute in Chicago, Illinois. Today's demonstration is going to focus on the use of tapotement during a treatment. The word tapotement comes from the French word tapote, which means to tap. This technique can either be performed superficially, kind of more light, or it can be performed at a more pronounced or deeper level. I would encourage you to use these techniques for a specific reason. These techniques many times are underutilized by therapists. It can be fatiguing on the therapist, but it can also be very effective if done correctly and used in an appropriate time. So we're going to do tapotement techniques today. The first three techniques will incorporate flexion and extension of the wrist. The first technique is called cupping. So you want to cup your hands and trap air underneath your hands. You'll notice that I incorporate this technique just kind of in the upper thoracic area. This technique is good for chronic conditions like bronchitis. I can then move to one side of the table, reach to the contralateral side, and again do this cupping technique. It should not be a slapping technique with your palms. It should be cupping. You're trapping the air into your cups and then just applying this technique. Notice that the rest of my body is very relaxed. It's just the technique coming from flexion and extension of the wrist. Another technique that we can use in the flexion extension of the wrist is point hacking. You'll notice I made very specific points by drawing all of my fingers and thumbs together. And then I'm going to focus this technique right between the shoulder blades, right into the area where rhomboids would be, metal traps would be. Again, I'm trying to stimulate the tissue here. Then I bring the technique out onto the shoulder blade itself, tapotment into the infraspinatus muscle, and then right around again rhomboids and metal traps. After I've done that technique to stimulate the tissue, I'm going to ask the client to retract their shoulder blades, to bring their shoulder blades together. I'm going to count down from 12 all the way to 1. So again, I've initiated the stimulation process and then asked my client to also stimulate the muscles on their own. Again, using the flexion extension movements of the wrist, the final technique using that movement of the wrist is called beading. Now, this beading technique, you'll notice, can be probably a little bit deeper than the other two. So I would focus this technique on larger muscle groups like the glute muscle and the hamstring muscle. Notice that I do the technique down to the level of the knee, but not past that. And I would not use that technique on the back. The other tapotment techniques that we'll use are going to incorporate a prayer position, or supination and pronation of the forearm. So the first one, you'll notice my fingers are all together, and I'm going to be striking the tissue with my pinky, or the ulnar part of my hand. So this is ulnar hacking. So you'll notice that I'm keeping my hands just lateral to each side of the spine. I'm not doing the technique over the shoulder blades. I'm keeping it right there in the mid-upper back. So this is ulnar hacking. Again, the rest of my body is nice and relaxed. You have your elbows out to the side and your hands close to your body. I can also do the ulnar hacking technique into the lower extremity. I can do the technique into the glutes and into the hamstrings as well. Very effective if you're looking to stimulate those muscles. The next technique looks a little bit like beading, but turned on its side. Notice my elbows are again out to my side. My hands are close to my body. This technique is called pounding. So I'm actually striking the tissue now, again with the pinky side of my hand, but it's a loose fist. My thumbs are towards the ceiling. That is pounding. The last technique is called hacking. Again, it's a prayer position, and I'm going to strike the tissue with my 3 fingers, my middle, 4th, and 5th fingers. And this technique is done again, moving pronation and supination. This technique is one that can be a little bit painful for the therapist to use, but I want to show all the techniques. Another effective technique that you can incorporate into the low back and hips is a vibration technique right onto the sacrum. I've placed one hand on the sacrum, another hand on top, and I just do a vibration technique. It's very good for the SI joint and those ligaments and the muscles around the sacrum. You can do it like I did with the sheet pulled down, or you can do the technique over the sheet. Either way is fine, both are effective, but it's a nice joint mobilization for the low back and the sacrum. Then after I've done that vibration technique, then I could possibly incorporate rocking as a nice way to transition again down into the lower extremity. So that demonstration was for the use of tapotment during a treatment. Again, use these techniques.
Okay, so this is your shaking. Okay, you can watch again. When the patient is doing exhalation, you have to do the shaking. Okay, that's all about the videos. So before going into the next part of the theory, I think we'll have some 10 minutes break. Okay, so we will come together. Now the time is 9:13. We will come together by 9:25. Is that okay?
Okay, Miss.
Okay, Miss.
Okay, Miss.
Yes, Miss.
So far we have seen the techniques. Now we will see what are the things that is needed for doing a massage. So the first thing is you need to have a well trained hands. That is very, very important. And the hand should not have any of the any roughness or any thickening or any scar tissue, because if you are having any scar tissue in your hand, then you will not be able to give the massage perfectly. So that is the most important thing. So you can see, like when you are doing a lot of works, sometimes the hands will get little harder, then it will lose its softness and suppleness. So you need to have a soft and scar free hands. So that is important. That is first thing. Then the hand should be very free to move. So you should not have any restriction or reduced range of motion in your hands. That means like whole of the upper limb. So the whole of the upper limb should be flexible enough to do the movement. So that is main thing. Main thing in massage. Then apart from that, we need to have a good cot which will be height adjustable. Okay, so the cot or the table, whichever we are making the person to lie down, should be height adjustable so that we can adjust the height according to the need. Then we need to have a firm mattress. You should not have a soft mattress, because soft mattress means it will go down. So especially if you practice on a pillow, if you see, you will not feel any pressure, it will just go down inside. So you need to have a firm mattress, that is very important. Then you need to have adequate pillows. So you need to have more pillows because we need to support the patient in a proper position. So you need to have more pillows. So then apart from that, we need to have a lubricant. So these are the equipments or essential things that is needed for a massage. So first is like we need to have a table, we need to have a mattress, pillow, and like we need to have good lubricant. Okay. Then regarding the lubricant, the first thing is like the lubricant is used to reduce friction and to have a good movement. Okay, so with friction, if you are doing the movement, it will be dragging or pulling the skin, which will be painful. So the patient will not get the desired effect. Instead, they will be having pulling pains of the tissue. Okay, so to avoid that, you need to have a you need to reduce the friction, so that you need to have a good lubricant. So this lubricant will help you to guide the hands whenever it is moving. Okay, so it will just slip, or it will just help you to just slip on the tissue, and it will avoid the complete friction, so which is very, very important. Okay, then this you need to before using the lubricant, you need to ask the person whether they have any allergic or anything, because some of the patients who are having hypersensitivity might have some allergic to any of the lubricants. So somebody will be allergic to powder, somebody will be allergic to lotion, somebody will be allergic to this brand lotion and all those things. So before applying it, you need to make sure that they are not allergic to that particular lubricant whichever we are using. Then we have four types of lubricants that we can use. One is like lotion, oil, creams, and powder. So we can use any of this kind of lubricants. So that will be giving you a good effect. Then we have to make sure that the lubricants are not contaminated, because if you are not using a proper disposal materials, so for example you take a bowl and take the lubricant in that, so you dip your hand and take the lubricant, then you use the lubricant. So in this case, like whenever you're dipping the hand and doing it, it might affect contaminate the particular material. So later on you cannot use it for the next person. So you need to make sure you have to put the lubricant in a bottle which has either a squeezing type or which has a pump, so that we don't contaminate the materials inside. So this is very very important. So first thing is you need to check whether the person is having any allergic with the lubricant. Then second thing, we need to avoid any risk of contamination, because you are going to treat many patients, so you will be using the same lubricant for many people. So you will be using some other, then again you will come and dip the hand in the lubricant. So which is not at all accepted. So you have to make use of a squeezing bottle or a pump, so that you don't need to touch the lubricant with hand. You can directly pump it uh, from the bottle. Okay, so that we can avoid the lubricant contamination. This is very very important. Next, so these are the essential materials that are needed for massage. You need a table with height adjustable, you need a lot of pillows, you need a hard mattress, and you need lubricant. Apart from that, you need to have well trained hands. So that is very important. Next, so what are the components of massage? So components means what are the things that we need to look into while we are doing the massage. So the first thing is pressure. So the pressure should be uniform throughout the massage, which is very very important. So it is not that you are doing it very hardly in the initial, then later on you reduce the pressure and you do it very mildly. So you cannot do like that. So the pressure should be continuously in a same thing for a very long time. So the pressure should be continuous and it should be rhythmic and it should be regular. It is not that they can apply for some time, they will remove the pressure again, they will apply. So you cannot do like that. So the pressure should be continuous. It's very, very important. Okay, so it should be firm and it should not cause any pain. Okay, so the pressure should be firm pressure, but it should not cause any pain. Okay, the next is rate and rhythm. So rate and rhythm is like it should be slow, gentle, and rhythmic. So slow and gentle you have to do. You should not do it very hastily. If you're doing it very fast, then you will not get the desired effect. So you have to do it very gently and you have to do it in a rhythmic manner. Rhythmic manner means you should not have some. That means like first time you will ask a person to do 4 times. Okay, then second time when you're doing, you should not do it 5. So it should be like rhythmically equal, so that it doesn't cause much of arrhythmicity in the treatment. Okay, then next is like you should not be hesitant in between. So while doing, you should not like stop and go. So that will hesitancy will lead to stopping the breaking the rhythm, which is which is not acceptable. So you need to do it slowly, gently, and in a proper rhythmic manner. Then in that also you should not be doing it in a hesitant manner. You should not do it, you have to do it regularly. There is no irregularity. Okay, so there should not be any irregularity. For example, a male is giving a massage to a female. In that case, like you should not hesitant to touch some of the body part. You have to give it rhythmically throughout. So that's why nowadays they prefer male to male and female to female, so that you have a rhythmic movement, you don't have any irregularities. Then medium is your any lubricant is a medium, so you can apply any lotion, oil, creams and powder. So it is up to you, you can decide with the patient whatever he wants, you can apply it. Then position of the patient and the therapist. The position of the patient should be very, very comfortable. Most of the time they will go for sleeping. Okay, so most of the time they will go for sleeping. So you will not be able to maintain them without any pillow or anything. So you better make them to be in a lying position and give them a complete support so that if they want to sleep also they can sleep, because that is the effective one. So if the whenever you are doing, if you are sleeping, that means you are doing it correctly. Okay, so that is the main thing. Then so that means you better position the patient to be in sitting position, then you will be able to do it. Okay, then next is give adequate pillow support. So you need to keep lot of pillows wherever is needed. So this pillow support, another thing, you have to refer back to your first chapter, fundamental chapter, how to position the patient, how to lie down, how to quarripone, and all those things. So you need to check and give proper pillow, adequate pillow support, so that the person is able to uh, be in a very comfortable position for a longer time. Okay, then uh, dressing of the patient depends on the body part they need to do the massage. So if they want to do for upper back, that means like you have to ask them to remove the shirt. If you want to treat only the lower limb, then you can ask them to remove only that area and cover up the remaining, and you can give the treatment. So depends on the treatment part. You have to see what you are supposed to do, and accordingly you can position the patient and undress the patient according to the need. In case if the patient has any edema, then elevate the limb and do the massage so that the person is having relief from the edema. Okay. So you need to elevate the limb so that the edema is drained out properly with the help of the gravity. So that's why you need to elevate the limb. Okay, then duration. Okay, just a minute, I'll come back. Okay, so regarding the duration, there is no hard and fast rule. It depends on the area. If you are giving to a very smaller region, then it may take only 15 minutes. If you are going for a bigger area, then it may take 30 minutes or sometimes 1 hour. So we don't have a very strict duration timing for the particular massage. Then frequency, it is done only once in a day. You cannot do twice or thrice in a day. Okay, so again it depends on the need, but most of the time it will be once in a day. You cannot do it more times. Okay, again it depends on the condition. For example, if you are going to give massage only for a scar tissue, that is keloid formation, then you can we can do it for 3 or 4 times. So depends on the condition, depends on the need, the frequency, duration, everything will vary. So some of the basic things you need to keep in mind is you need to maintain the evenness of the rhythm. That means evenness means the pressure, the number of times you are repeating the technique, the rate in which you are doing, the speed at which you are doing, all these are called as the rhythm. So all these things should be even. So for example, if you are doing effleurage, whenever you are doing effleurage, if you are doing 3 or 4 times and suddenly you do 5 times, suddenly you do 3 times, it is not acceptable. So you need to maintain the evenness throughout the treatment session. So if you are doing 2 times effleurage, you need to do it throughout the session only 2 times. Okay, so don't change the rhythm. Don't change the pressure. The pressure should be continuous and it should be proper. You should not remove your hand. The contact should be continuously present. Then the rate of the movement also should be always should be the same. It should not be up and down. Okay, then you maintain the flexibility of the hand. It is very important. Without the flexibility of hand, you cannot do massage. So you need to have a good flexibility of the hand. Then regulate the pressure according to the kind of tissue. That means when you are applying the pressure over the over a particular bony area, then you can reduce the pressure. When you are giving it over, sometimes when you are giving it over the spleen and the kidneys in the back region, then you have to reduce the pressure. So that's why it depends on the area of the tissue. You have to maintain the pressure, but most of the time you have to maintain the pressure throughout normally. Then you have to do it gently, slowly and rhythmically. The rate of the movement is very important. Your flexibility of the hand is very important. The therapist stance is always walk standing position. So facing the patient so that easily you can move to the other side of the patient and do the movement, continue the movement. So that is very important. Walk standing position is very important so that you have a good forward and backward position, forward and backward movement. Okay, so walk standing position is very important. Then, so this is regarding the pressure. It should be equal. Okay. Other than that, you don't have any set frequencies like number of repetitions or number of things. So everything depends on the need of the patient and how you are designing the treatment protocol. Then during the treatment itself, you have to ask the feedback from the patient. How they are feeling, whether it is tender, whether the pressure is okay, all these things you have to talk. So don't just allow the patient to sleep throughout the session. Then you will not get the feedback and you will not be able to improve your treatment. So feedback is very important. Okay. Then now after the massage, you need to clean up the lubricant whichever you have applied. Okay, clean up the massage lubricant whichever you have applied. Make appointment for the next treatment. Instruct the patient about the level of activity they can perform after going home. Okay, then record the treatment and any special responses to the treatment. Sometimes when you are doing the treatment, it may become red, it may become show any signs of any other warnings and other thing. So all those things you have to record and inform the supervisor, which is very important. Okay, then last is like keep your hands free of any callus formation. So normally the hands should be soft and smooth and without any scar tissue. Okay, normally it is like for the girls will be having lot of scars in the hand because of their household works or anything. So you have to avoid all those things and keep your hands free of any callus formation. Some the points to be considered like it is again a repetition only regarding the pressure, regarding the rhythm, and regarding the duration. Depends on the area and depends on the duration, depends on the condition. Okay, then next is main thing is regarding the swelling. So swelling, the reason for swelling can be many types. So one of the reason for the swelling is lymphedema. One of the reason for swelling is any lymphatic blockage. Lymphatic blockage means the lymphatic drainage will be blocked because of any surgeries or any other things. So here what you have to do is you have to remove the block first, then again you have to start from the distal part of the treatment. Okay, so normally when you want to reduce the swelling, you will be starting from distal point, then you will be going towards the proximal point. Okay, then only you will be able to drain the patient completely. Okay, but when they have this lymphatic blockage, first you do the proximal, remove the block, then you do from the distal. Okay, this will help you to reduce the problem. So for example, you can just imagine if the lymphatic system is blocked or completely closed. If you keep on applying pressure, what will happen? The pressure will be bursting out. Okay, so to avoid this, what you do is first you do the first you do the proximal, you remove the block, then you start from distal to proximal. This is very, very important. Okay, and it should never be painful. You have to, the person have to enjoy the direction of force. Again, it is matters. Again, it depends on the condition of the patient. Then again, you have to always start and stop with effleurage, which is very important. Okay, so you have to start and stop with effleurage. Then in case if you want to keep the body elevated, you can keep the body elevated, and massage should always begin from superficial stroking, and then it has to go with the other. Okay. Regarding the sequence of treatment, we will see this after we are seeing the practical aspects. Then only you will understand the sequence. Okay, is that clear? So next class we will see the practical aspect. Then after that we will see the sequence and other thing. So before next class, so today is Friday. So before next class, I want you to go practice all the technique so that we will be able to, you will be able to understand when I am teaching the practical aspects. Is that clear? So I want you to practice over the pillow. I will be able to upload the slides in the LMS and other thing. Okay, so no, don't worry. All the recordings and other things I will be uploading after the classes. Okay, only thing is in the campus, since there is exam is going on, there is little bit issue with the internet connection. So with our mobile internet connection, we will not be able to upload the class recordings, because once I record the class, I have to convert it in the YouTube, then only I can upload. Okay, so for that it will take time, but remaining everything we will be able to upload immediately. Is that clear?
Yes, Miss.
Yes, Miss.
Miss.
So before today itself, I will upload all the videos and other thing. Okay, so you try to practice the things. Then next class we will see the practical aspect. Okay. See, for the classes, if you are coming it too late, then I won't be able to give you the attendance. Okay, so for example, if you have 2 hours class, most of the time we are not going to take complete 2 hours class. So we will have break in between 10 minutes. So if you are attending for last half an hour, last 15 minutes, then no point in giving you attendance. So either you need to give me the reason why you are coming so late. At least like 5-10 minutes late is acceptable, but 1 hour, 1.5 hours late is not acceptable. Is that clear? So next time
Yes,
you
Miss.
at least you join in 5 or 10 minutes back. I still like before 5 minutes also somebody came in. Okay, if it is because of internet issue, you have come in, then you have gone out and coming in again, then no problem. But if you're joining newly only for 15 minutes, then you will be losing the classes. Okay, okay. So thank you. So see you on Thursday.
Thank you, Miss.
Thank
Thank
you.
you, Miss.
Thank you, Miss.